Hi everyone. I don't know whether it's me. I can't hear anyone. It might be me. I can't hear Charlotte. And I've had a couple of messages saying they don't think their laptop is working, but I think there is a problem with the sound.
Right, okay. Can you raise your hands if you're having issues with hearing me?
I can
Mine's
hear
only
you.
just come back on, Charlotte.
Seems to be working now.
All right, okay. So don't tell me now. I've read all that and all of you have actually not heard it. But I think
Exactly.
that's a bit of a... Yeah, bear with... Do we have to? Tell you what, we'll just carry on. You don't want to hear that all again, do you?
Just do declarations of interest.
Yeah, I'll go back to declarations of interest. If you just bear with me now then. I was motoring then. Agenda item 2, declarations of interest. Are there any declarations of interest?
I can't see any declarations of interest, Chair.
Agenda item 3, you will see the minutes attached at pages 5 to 12 in your agenda packs. If you feel these are minutes are an accurate record of the meeting, I will propose, and please can I have a seconder?
Second, Chair.
If members do not indicate to the contrary, then I will take it that these minutes are approved.
These minutes are approved, Chair.
Agenda item 4, adult services prevention, early intervention and community services progress update report. In briefing for you to know, we haven't got specific questions on this, but I would appreciate just a brief, if possible, please. And this report is for Norton.
Yeah, thank you, Chair. So members will recall that I previously presented this to committee, that prevention and early intervention services were the missing link in adult services infrastructure. We cannot prevent people requiring a statutory service, but with timely and effective preventative services, we can slow down that journey. Sarah Waite was appointed as Principal Officer for this service in late 2021, and this report will provide an overview of the work Sarah and her team have undertaken since that time. And I'll pass to Sarah. Thank you, Chair.
Is Sarah here? Yeah, bear with us. Do you want to call her in?
I spoke to her 5 minutes ago and she was ready to come in.
She is you. Yeah. Maybe having problems with her laptop, maybe.
Yeah,
I
mine's
think
only
we have
just
a
come
few
back on.
problems today, to be honest.
Mhm.
But we'd all still
Hello?
happy, are we?
Yes,
Yeah,
you are.
Ciara.
Oh, so I was having trouble getting off mute then for some reason. And my camera is playing up, so I am here. Apologies. So if I can take you straight to page 5 of the report. I'm not sure what that is from the cabinet report, as I've not got the papers around that, but it's the diagram which shows almost like a 6 pillars and prevent, delay, reduce and manage. I'm not sure if you've got that.
It's page 17, everyone.
Thank you. So this basically, I think, sums up a lot of the work that we've been doing. We wanted to really capture visually the aims and objectives of the prevent and early intervention element, and we set that out as the top, so communities where individuals can thrive. That's really what we're set out to do. The second element of that then is our sort of aims and objectives. So we want to achieve resilience, and we want to work with individuals in the community through promoting inclusion, but also ensuring that we get information and advice and working with the community. So that's really important that we stick by these principles. The pillars that you will see underneath that are the work that we are currently engaged with, and also sets the scene for next year's work as well. So hubs is around a community hubs development. So we are looking at mapping all of the community hubs in across the wards, and we've already done quite a significant piece of work around this, but also looking at opportunities to bring services together and to get much more of a community early help, if you like, offer within communities, and in places where community members go to on a regular basis. The next element then is the volunteers. So for us, volunteering is really key. It gives individuals purpose, but it also provides an opportunity for them to give back to their communities. We have got a volunteering provision as part of adult services, and we're looking at how we develop that further. We've made some really good links with the Youth Offending Service and Complex Disability, and we're also linking in with employability to look at how we strengthen that going forward. Limited company, so this is very much around looking at alternative models of delivery, and scoping out whether or not a social enterprise model for the delivery of prevention would be something that we could consider, or at least in terms of some of our model of delivery. So this is very early doors, but we have started and are working towards getting a scoping paper at this stage ready to sort of come forward around opportunities for this. Carers are critical for us. They're critical for the delivery of services across the council, actually. And we are undertaking a review of carers and the work internally that we can do to strengthen our delivery model, and that's ongoing, and there will be a report come into this committee early next year. Loneliness and social isolation is another key strand for us to work on, and we've got a draft strategy and implementation plan which is being co-designed with the community groups and community members. And there is some, hopefully some additional funding from Welsh Government grant that we'll be able to utilise in the new year to strengthen the delivery of that implementation plan. And last but not least is certainly that community collaboration. So that's working with our communities to understand what their needs are, where the gaps are. And we've got a number of staff at the moment who have been going out and undertaking quite a broad range of community engagement to look at the different needs of the population that we have. Under this then is digitally enabled support. So that's really about digital inclusion, but also assistive technology, and how can we start to strengthen those areas where they may not have digital skills or digital enablement. How can we strengthen that? And also what opportunities are there for us to look at alternative models of support alongside people that can help people live more independently. And we've got a number of examples which you know, are in the paper that we've mentioned. Key things, I guess, for the service are prevent and delay is our bread and butter. That's what we want to be doing. So anything which falls into those two categories, we should be owning as a prevention early intervention service area. Where we're looking to reduce and manage, these are things where we can support other services to deliver and to ensure that they are as robust as possible as well. So we are quite a broad area, but and there's probably quite a lot of detail in the report around the aims and work that we've been doing over the last 6 months plus, really. So I hope that's given you a very brief overview, really, of our sort of aims and objectives and sort of direction of travel for our service.
Thank you for that, Sarah. It's one of the items that, as you're fully aware, that I'm very excited about, and it's great actually seeing the team all coming together now. And you know, it's obviously an area that we're very confident in going forward with as well. So a big thank you to the team and yourself for that. The only one thing that I got to comment on that, unless there's any other councillors got any other questions, is I thought the good news stories examples were fantastic. However, I would like to see any bad ones as well. Obviously, ones that are not engaging or not working out as well, because I think as councillors we like to know the good and the bad. So they are two fantastic stories, so big well done for that. But again, I would like to also see what maybe we're struggling on in the engagement or getting someone obviously from isolation back out into the community and that, if possible. So is there any other questions from any other members? No, that's it. Thanks for that.
Thank you, councillor.
So this report is for Norton. Agenda item 5. We will now move on to the Cabinet agenda for pre-decision scrutiny. As previously mentioned, we've decided to scrutinise items 7, 8, 10, 11, 14, 15 and 16. I'll just give you a minute to go back over to change the on your iPads. Agenda item 7. Permission to provide information on the transformation programme, the Alliance outline business case. This report is for decision. Officers, would you like to add anything additional to the report, please?
Thank you very much, Chair. So this report sets out a business case and a recommendation for working in partnership with the other Area Planning Board statutory bodies to deliver what is called an alliance delivery model for substance use services provided in the West Glamorgan region. The recommendation of this business case is for the APB partners to recommission a new integrated service using something called a cooperative commissioning model, which will then drive forward better collaboration when working with vulnerable people. What it will involve is the procurement of a new integrated substance use service through something called an alliance contract, and that will replace the current range of services and contracts that are being commissioned by individual APB partner organisations. And to do that, that will then require us to also commit to a pooled budget arrangement. So the overarching intention of that work is that the Alliance will be able to deliver a more integrated public health model of service for those that are at risk or are experiencing physical, psychological or social harms involving substance use. In that way, we'll be able to provide a more holistic and person-centred intervention and reduce the harms caused by problematic substance use to individuals, their families and their communities. The APB partners have met and agreed in principle to the recommendations in this business case. And so each area planning board partner now has been asked to seek agreement in line with their internal governance processes to the recommendations within this business case. Thank you.
Thank you, Shelley. I have questions from Oliver, please.
Thank you, Chair. Thank you, Shelley. Very good report. My question's in 3 parts, basically. But if I do the 3 questions in one, you probably will answer them all in one. Looking at page 14, Valley's community impacts. Any update on the provision of substance treatment support? The report states that the service needs to be improved. Also then on page 19, January 2020, the agreement to drive forward a joint approach with public health. Yet looking at page 22, the timescale, the programme started in 2023. So there was a 3-year gap from the agreement to starting.
Yes, I'm hoping I might be able to answer that, but I'm sure Anne Harrod might be able to come in because that was before I started post. My understanding is that there was a huge commitment. So this was born out of some work that identified that the region had a high level of drug-related deaths and drug-related harms, including near-fatal, a high number of near-fatal overdoses and bloodborne viruses. So the APB and the PSB came together and said, okay, we really need to make sure this is a priority for us to reduce these harms. And through those conversations, this work was instigated. However, my understanding is there was a delay due to COVID, which, with a number of projects, hasn't it, meant that resources had to be kind of realigned, and now we're in a position to drive this work forward. And we've appointed Anne Harrod, who will be the key officer working with all these partners to take forward this agenda. Anne Harrod, did you want to add anything to that?
Just to agree, Shelley, I think there have been a number of delays with COVID. That's not to say that there hasn't been some really positive work in terms of progressing some of the outcomes that are intended with this programme. However, my coming into role now, bringing together the range of responsible authorities and services together and collaborating in terms of delivering these objectives, this is the starting block now. This is the business case to gain that agreement and to really move forward with clarity on very much a systems basis. It's sort of, this is the beginning really of that process with a very clear plan. I think what we had before was slightly disaggregated across the responsible authorities. So my role is really to focus and deliver this at pace, because I think you're quite right, there has been delays, and now is the time really to move forward with pace, because we see this continuing harm across our communities. So yeah.
Thank you for that. Obviously, I didn't take COVID into account. I don't think of COVID anymore. Thank you.
Did you have another question as well, Oliver, or is that all?
No, agenda 9, my next one. Agenda 8, my next one, Charlotte.
Okay, no problem. So the recommendation is listed on page 16 of the Cabinet Board Agenda Pack. I will propose, can I have a seconder, please?
I'll second, Chair.
Can members please indicate if they wish to abstain?
I see no abstentions, Chair.
Members, if you do not indicate to the contrary, then I will take it that this decision is supported to Cabinet. Agenda item.
Sorry.
Oh, sorry.
Sorry. Chair, I can see no indications to the contrary, so this recommendation is supported to Cabinet Board.
Agenda item 8. Again, this report is for decision and it's the Neath Talbot Youth Justice and Early Intervention Draft Youth Justice Plan 2023 to 24. Officers, would you like to add anything additional to this report, please?
Good afternoon, everyone. I just wanted to introduce Ali Davis as the lead officer, who was, I know everyone's had an opportunity to read the report, and Ali is available to answer any questions.
Ali, are you going to give us a little brief?
Oh, sorry, I was.
It's okay.
sorry, Charlotte.
In fairness, you haven't actually been back to committee, I don't think, since we've had for the new councillors. Just a little brief overview.
No, sorry, I was just waiting to come in there. Sorry. Okay, so it's a huge piece of work, huge document. I know we go through this every year, so I'm just leaving it open for questions, really. I wanted to share with you the feedback from the plan, which I know members and the chair have seen because they came back to visit us at the centre a few weeks ago. So this feedback summarises what the YJB have graded this report as. Now, you'll have seen the report, and last year's grading was good. They've done away with the grading now as was, and they've got it in quadrants. So we've been put in the first quadrant, and there's only 2 youth justice services in Wales that have achieved that this year. So we've gone up a notch, which I'm really pleased about. What the Youth Justice Board have said about the plan is that it's a very strong plan, it's well written, it's easy to understand. The strengths were examples of innovative good practice, emphasis on education, good partnership working, some really good innovation, including equine therapy and the K9 project. They wanted more detail on outside and what that involves, because there's been some really good feedback and results with that with young people. And court work, they wanted some breakdown on court work. Examples of effective practice: equine, K9 project, Perfectly Imperfect Girls programme, music projects, hairdressing and barbering qualification, bike maintenance. Areas of challenge: the risks, finance, like everything else in the world, workforce recruitment and retention. We've addressed that. We've fully staffed. Provision of ISS packages, which are very resource intensive. Sorry, my phone is going off. IT infrastructure, consideration of reoffending rates within such a small cohort of children, support to volunteers and training to include volunteers understanding the latest developments in youth justice. And the quality comment, it's a strong plan that was easy to navigate, lots of examples of practice that we would like to explore and consider sharing on the resource hub. And finally, an absolute pleasure to read. And that's good coming from the YJB, believe me. So the YJB have been far more, they're far more visible now. There's far more scrutiny, and they're very proactive in looking at everything we do. So we've got to report to you, Chair, we've got to report to Children's Services, and we've got to report to the YJB. So there's an awful lot of scrutiny going on. Other than that, it was lovely to see the members and the chair visit the resource centre, which we're very proud of, and I'm sure you've got your own opinion about that. And we continue to go from strength to strength for the young people there. Key areas of good practice that I think are evidenced in the report: SALT, speech and language. We've got a CAMHS nurse. We've got a sexual health clinic. We've got huge participation and engagement and representation of board. There's good work with education, outside and neurodivergent, and recognition of the impact of. Staffing is up to speed, management is full, and equine assisted learning. Areas to develop: board activity, oversight and contributions, and engagement with the courts. And I think that's it from me, and I'm sure there's people who want to ask questions.
Yes, thanks for that, Alison. Can I just bring in Oliver Davis, please?
Thank you, Chair. Very interesting report, Alison. A good read. The only thing I want to ask about is on page 91, where you got total budget for partnership.
Right.
Now I see at the bottom you got health. Is that the health authority? And if so,
my page.
Their contribution works out at £82 a week. Who sets that, or is it just something that they decide to give us?
It is set. It's a contribution. It's a partnership arrangement. Hang on, I'm just finding it. Page 91, total health. Yeah, it's basically what is given by the health authority. They're under no obligation to give anything, other than what they can afford. So that is determined by a health contribution. They give in kind, in that we've got posts, we've got our speech and language, which is commissioned, and we've got our CAMHS nurse. We've got access to the health board and their representatives. So that it's not just a monetary contribution, to be fair.
Okay, thank you.
Councillor Patterson, please.
Thank you very much, Chair. Can you hear me? I'm unmuted. Sorry. Beg your pardon. Missed something. Thank you for allowing me to come to your committee today, Chair. There were a few items that I did have interest in. I've noticed on page 143, in red, something that the police are being a bit slow on, perhaps. Can you explain that to me?
I'm just looking through 143. Sorry, 143. Let me, bear with me. 143. For some reason, my
or is it page 67? I don't know. I got different numbers.
I've got the two numbers because I've got both open. So let me just check.
It's on the tables, and then there's two items which are in red.
Right. Okay.
9 and 10.
Okay, 9 and 10. That right. Okay. So so that was our youth justice action plan. That was
right.
So from where I'm sitting, I've got 9.1. Oh, there we are. There we are. Potential gap within child criminal exploitation CSE coordinator post. Okay, no, this is an old. That was the old plan that was, which right. It has been updated. That's been addressed.
Okay, that's fine then. Thank you very much. Thank you, Chair.
John?
Yeah, sorry. I just want to make a statement. I just want to say a massive thank you to Ali and her staff because they play a massive part in turning these young people's lives around, and a fantastic job with the activities they do for the children and the young people. I was privileged in the summer to be there for one of the K9 projects when I think, is it John Ali was giving his story, and I think it's lovely how they get to hear these stories of real life crimes, so that hopefully it'll sort of make them go away and think. And one of the comments from the young people was their kindness, and they get you involved. And that's what I found. There was no pressure, no forcing anybody. We're going to do this little activity here now if you want to join in. And they did, all bar one. When I went on 2 visits in the summer, they all did join in, and it was really good. And you can see them engaging. There was one man, I think they were going kayaking that afternoon, and he didn't want to go. He was absolutely didn't want to go. Nobody was forcing him or anything. I just said, why don't you want to go? And he went, I can't swim. So I thought it was, but they do some really, really good activities with them. So well done up there. Really good job.
Oh, thank you.
Oh, sorry. Thank you for that, Shan. Questions from myself. And again, we did, all of us who attended, we all enjoyed Base 15. And again, we would like to obviously come again in the future when obviously there's a lot of children are there, and we can actually see, because obviously we missed the activities the last time. But again, it was important for us to know how it all operates as well first. So we'll be doing a lot more of visiting going forward as well. So my questions are, I'm a big fan of Ortside. I think the work they do is great, and I think the reports show that as well. My question is, all the staff and agency partners that work with you, do they all have training as well by Ortside? And if it's not Ortside, do they have training on neurodiverse? Because obviously that's coming quite blatant in statistics and that now, that a lot of the children are neurodivergent in the system as well. So I'm just thinking what training that all staff have on it.
So all our workforce is a trauma-informed workforce, and part of that is also, I mean, it's in the report, but I can't remember which page. I can look it up for you. All the training that's available to our staff. We are a trauma-informed service, and we are also involved in the ECM model. So every young person who is identified as having a specific neurodivergent difficulty, whoever works with that person will receive training, and every young person who comes through our service is given a speech and language screening assessment by a speech and language therapist. And I'm sure you all know the difficulties there are across the piece in getting speech and language assessments and speech and language intervention. So we're very privileged. We've got some tremendous interventions and resource available to us, which we've worked very hard to obtain. So the answer to the question is yes, every child will get a qualified or trained worker.
Great. And another question I have for you is, considering that there are high numbers now of school exclusions, this year is higher than ever. I'm quite interested to see the low number of referrals from the school compared to social services and the police. Is there obviously, something in the process or something that obviously we're not aware of? So you can just explain that bit.
So we've got a full-time education training and employment worker now. But the last 2 years have been difficult because we haven't had a person in post, because the original post keeper was off. So we've got that person now. We're doing a lot of joint work with the schools. We've got Chris Millis, who is our education rep on the management board, and his teams are working closely with us in risk management and risk management panels. So we are conscious that we've got a lot of work to do with education, and that's across the piece. That's alongside children's services as well. So we are developing those education strategies and we are looking at strategies to reduce exclusions, and part of that is having alternative provision at the resource centre for specified parts of the week, so that children aren't excluded per se, but they're allowed to come out and do some work with us on reduced timetables. But it's something that we're very aware of, Chair.
Thanks. It's me again, sorry about it. Bear with me. On page 46, I welcome the capturing of the data and analysis, because I think that's really key going forward. So that's a really good, positive one. And on page 42, know with that. 49, sorry. 49. You've got there's 15 people obviously statemented, yeah? That one.
I'm still on page 90, sorry.
Page 50. Yeah, go on. I'll give you 2 minutes. Page 50 it is.
It's my bundle doesn't start until page 81, so I must be on it, and I'm on
126.
Hang on, okay.
Try 126. It is a bit confusing with the 2 numbers on pages, isn't it, sometimes?
Yeah. Sorry.
No, it's okay.
126. Sorry, Charlotte, if you tell me what the
basically it's the chart it is with the statement sen, and then the statement need.
Right.
And it's just the case of, are you actually finding, obviously you've got a like Cam's nurse and we've got staff there, but obviously there are a lot of children between the ages of 13 and 15, which are the most crucial in education as well, are still waiting for diagnosis on the diagnosis pathway. So are you actually seeing a difference or an increase in this with obviously the waiting times? Is there an issue with the waiting times?
An issue of waiting times for diagnosis of
a neurodiverse condition, yeah, because you've got birth statement need and then statement sen, yeah.
Yeah, there is a difficulty in waiting for diagnosis for ASD and neurodiversion across everywhere. I think what helps us is our speech and language assessment, which is picking up communication. I found it now, 125. Yeah, our speech and language therapist and their team are screening, so we are picking up communication difficulties which may not have been picked up in school, and these are significantly older children, so they've gone through a whole school life then, if you like, and until they've got to teenagers and not been diagnosed with potential communication or ASD behaviours. Now, that is obviously a health and education difficulty, but we are highlighting it as a concern going forward as well.
Great, thank you, Alison. The recommendation is listed. Oh, sorry, Ellen. Quick off.
Oh, sorry. Page 120, reoffending rates. Given the backlog in the justice system we know exists at the moment, how are your reoffending rates? Are your figures accurate, or is it? You know what I'm saying? That you may have people waiting for trials or what have you. Are your reoffending rates that just they've been charged with it, or that they've been convicted of whatever it is?
No, I'm going to bring Carl in here to talk about the reoffending rates. Do you want to explain that, and then I can tell you a little bit about waiting times in the court? Carl, are you there? Hopefully.
Yeah, I am. Yeah, you know, if I am there, I am here. Reoffending is always quite a tricky one to try and interpret, because if you look at the figures, they're always like an 18-month lag behind time-wise. The reason being is that all the reoffending figures are actually calculated by the Youth Justice Board themselves via the police. So they calculate it on a 12-month figure, but it's always about 18 months behind, because the way they calculate it is to allow a young person, if that's the right expression, to actually reoffend 12 months later than their original offence, or their outcome. The original outcome is then allowed to run for a further 12 months to see in that period whether that person reoffends. There's always a 6-month addition on to that. As you mentioned, that if they reoffend practically on the 12th month, they still have 6 months to go through the court process in order to get a further outcome. And once they've received a further criminal outcome, that's when they're classed as a reoffender, if that makes sense.
So what I will come in there and say is that our chair, who's also the director, Andrew Jarrett, has raised with the courts and judges actually, and written to them and has voiced concerns about young people being held on remand for significant amounts of time before being charged, before trial, sorry, and before an outcome. So that's been less now since COVID, since the pandemic has ended. We've seen a drop off slightly, but there are concerns mainly around the CPS taking so long to charge and for outcomes to be, you know, young people again to the age of 18, and we've got to be very careful that they're not receiving an outcome or a trial as an adult rather than a young person. So we're very, very aware of it, and the chair of the board keeps it high on his agenda.
Can I come back on that? Right, okay. Councillor Freegard, please.
Oh, thanks, Chair. Really sorry, I'm having problems with my PC. It's just decided to switch itself off, so I'm back on the iPad. I was just going to ask Alison, the figures for reduced timetables, does it come to this committee or will it go to the education?
Good point. Hang on. The figures for reduced timetables will be part of our reports and our scrutiny to our management board, and I would imagine they would go to education committee as well.
Right, it would be interesting to have those figures,
them,
because obviously,
yeah.
When we're talking about exclusion, we mustn't forget about the reduced timetables.
I think the difficulty I've got on this report is that it's a prescribed format. I mean, I can certainly include it. I mean, we're given this format by the YGB so that there's consistency across the board, and that isn't on the list. But I can certainly put it in there, and I can certainly find those figures for you and provide them for you.
That would be great going forward. Thanks, Alison.
Okay, no worries.
Councillor Paterson, please.
Thank you, Chair. It's not really a question to our officers, but I think somebody mentioned earlier that young people weren't being diagnosed in the education system. Would it be prudent for you or for the DEM services to ask education why they're not being diagnosed?
Is that a question for me?
Or does the officer know anyway? I mean, if you know, great, but...
So I think there's one of the main problems at the moment is the complete lack of speech and language therapists who are key to diagnosing these communication difficulties and will set them down the ASD pathway. The other difficulty which compounds that is the waiting time for seeking medical and psychological expertise around ASD. So there's a combination of factors across the piece from health and education, which means there's a significant delay. But every child who comes into us either on intervention, early intervention and prevention, or directly from the courts, will have this speech and language assessment, which often picks up these communication difficulties later on. We presented evidence to the Senedd earlier in the year, and Neath Talbot was and has been picked out in their report in the last couple of weeks as an exemplar of good practice around speech and language provision in youth justice.
Yeah, thank you, Chair, for making. But I'm not asking our officers who are doing the youth justice and prevention, but it just seems like we shouldn't be waiting until they turn up in youth justice to sort of diagnose. We should be trying to prevent them. Now, I'm not saying it's the officers present today, but it might be something that education are not actually picking up on. I think we need to investigate that in some way. I would leave it up to you as to how we could go about that.
Can I come back in there?
Yeah.
Sorry. So they are aware, education are aware that this is a problem as young people come through youth justice, and there is work being done on a joint basis to look at how those young people and how those, some of the screening assessments can be done in school, for example, and how that can be addressed.
Okay, Chair, I'll leave it up to you if you need to contact education to find out if that work is actually being done. Because once they turn up in youth justice, we've missed a trick there. We should have caught them earlier.
If I can just come in there now. If I just come on. I can't remember the accurate date, but we do have the neurodiverse strategy plan coming to committee shortly. And I think during that meeting, if we ask for ASD leads from education to come in on that, because I think even though there is a lot of joined up working going on, I still think there's room for more. Again, the schools only deal with the issues that are in the school, whereas we actually look at dealing with the issues that are outside the school, and obviously the justice, youth service as well. So I think if we can actually bring that in, obviously on that item, I think that would be good.
Okay. Thank you.
Okay. So there's no more questions. I can see. So the recommendation is listed on page 80 of the Cabinet Board agenda pack. I will propose, can I have a seconder, please?
I'll second, Chair.
Can members please indicate if they wish to abstain?
I see no abstentions, Chair.
Members, if you do not indicate to the contrary, then I will take it that this decision is supported to Cabinet.
Chair, I can see no indications to the contrary, so this recommendation is supported to Cabinet.
Thank you. Agenda item 10, social services, children and young people single point of contact, also known as SPOC. This report is for information. Is there anything that officers wish to add to the report, please?
Hi everyone. I just wanted to introduce Nune. She's known to all of you as Nune. I feel the need today to call her by full name, Nune Alexanian, and the team manager for SPOC, the new team manager, Carly Crocker. Who both experienced officers, and this report has come in following us making you aware of the sustained pressures in the front door, which has hit children's and adult services during the pandemic and post-pandemic, and where at that time we didn't know whether it was just a bulge in the amount of work coming through and whether that was settled down post-pandemic. We can see now that this is really the new normal. So the Nune and Carly will talk through the pressures that there's been over the last couple of years, how we are managing those pressures and the impact really that's had. So you've asked for some reassurance and some more detail around the front door, and I'll hand you over now to Nune.
Thank you, Kerry, and good afternoon, everyone. So as Kerry kind of introduced, we put this report together to share some information on the current pressures in SPOC and the plans we have in place to try to support those things. We are reassured and we are kind of satisfied that although there is a increase in our referral rates, which can be seen by the numbers that have been kind of included in the report. So we've gone back about 3 years to just show the kind of consistent increase in the referral rates coming through to the front door over the last 3 years. Obviously, because we've only gone back 3 years, it's just prior to the start of the pandemic where you'll see that there was a drop in the numbers in the referral rates when we first went into lockdown, and then a steady increase as the years have gone on. That hasn't come down. There's no indication that that's going to come down at any point moving forward. So as Kerry said, we've kind of come to the conclusion that this is our new norm based on kind of the data and the trends that we're seeing. And as a result, we're putting in arrangements to try to support the front door and ensure we're meeting our safeguarding responsibilities to the standard that we're used to responding to. And that's kind of the summary of the report. I am happy to take any questions specifically, or I'm happy to take you through the support plan, which is included in the report in terms of the measures we put in place, all of which are temporary, but they're in a means of bolstering the front door as we go through our recruitment process positively. As Kerry mentioned, we do have a very experienced team manager that's come into the front door now. So Carly Crocker, which some of you may know from your work in the communities in the kind of Neath area. Carly was our team manager of Court Start Community Children's Team, and she came across to the front door to head that up for us as a social services, children's services department. So she comes with a lot of experience and has come in and taken the reins of our front door, and we're definitely seeing the positive impact of that. Obviously, recruitment and retention is a bit of an issue across social work across the country. It's not a unique experience to Neath Talbot. That is a trend that we're seeing across the country. But positively, what we are seeing is that we're seeing an increase in kind of some interest in applications and things coming forward and moving into the future, which is very positive in terms of forward planning. The front door has had some vacancies that have come through over the last 8 months. Certainly in this financial year, we've lost some experienced members of staff. That has been down to staff kind of feeling burnt out, kind of talking to us about how they need a little bit more work-life balance, that the front door is under a lot of pressure and they've been there for many years, and that they need a bit of a change of pace. So that's what they've kind of looked for in the next stage of their career development. And, you know, so we've taken that, we've responded to that, and we're looking at different ways of supporting the team in order to help alleviate some of the pressures on the qualified staff in order to be able to focus on our statutory and our safeguarding responsibilities. Happy to take any questions.
Right. In regards to the issues with staff and that, I'm assuming that the average time of wait on the telephone is higher. What is, do you have the average wait time on a call coming in?
So at the minute, Councillor, the calls from the public are answered by our contact workers that sit within adults services, that sit within adults box. So I don't have those numbers to hand. There is a plan in place where we will be starting to take our own phone calls in children's services, looking at a date to implement that. We're bringing support staff to be able to do that. I am able to bring you the data for that. We can bring that to the next scrutiny. But what I would say is that the changes in the staffing structure, the recruitment difficulties in the staffing structure are about social work recruitment, not about the contact officers recruitment. So that team hasn't been impacted as such. What I'm referring to is the actual qualified members of the team that go out and do assessment work, not the ones that are answering the phones kind of at that first point of call.
Okay, so what is the average wait then for a social worker to actually get out to a call?
That'll depend on the kind of needs of the case. So every case that's referred into us is actioned within 24 hours. So we make inquiries within kind of the day that we receive it. We have a structure in place where the team will go out and make inquiries. So that means things like lateral checks with our partner agencies, perhaps contacting the family and kind of getting those early indicators. If it's a safeguarding nature, we'll go out on the day. If it's a kind of early intervention and prevention support, then it depends on our kind of availability. But all of our referrals are responded to within 24 hours. All of our initial inquiries are made within 24 hours, and we work through allocation. No case takes longer than, I would say, if it's low level, no case takes longer than a week for contact to be made formally for a social worker to go out. But that initial contact, that initial phone call to the families happens within 24 hours of us receiving the referral.
Great, thank you, Nune. Councillor Patson, please.
Yeah, thank you, Chair. Just in answer to another question that came to mind after you've just spoke, with senior experienced staff feeling that they need a better work-life balance, how often or what is in place for the staff we have left to contact superior staff or the next level to say they're experiencing this pressure? And because of the working from home, do social workers tend to work longer hours without actually saying it in order to meet our targets?
I'll if I may come in there first, Chair, and then ask Nune and Carly, who was bound to be chomping at the bit to answer some of the questions as the operational manager, who was you know, the frontline manager day to day, to be fair to her. So the really good points. I think what happened was, you know, initially we thought that during the pandemic, the irony was that perhaps frontline children's social workers were able to perhaps achieve a little bit of that work-life balance, because there was the first opportunity ever to really, you know, to have some time at home. The reality, as the time went on, was very different, because you literally, I described it as being, as we literally went from, you know, morning to night and just slept, got up and sat at the laptop. And I know that was the same for so many. Coming back into work, we tried to get that balance right in learning from the pandemic, and you know, coming into those really important things, because you have to have an interface. We're a social service, so you know, those supervisions, team meetings, training, development, and just hanging out together, spending time together, talking about the business is vital within a social services, and in particular with children's services. I think, you know, from my own perspective, workers hang on, managers hang on for as long as they could, and as the pandemic was sort of coming to an end, if that's the right phrase, that's when I think people started to become unwell, to become they were shattered, and they'd been shattered for a very long time. And it was only when we started to come out of that, I think, you know, we saw that sort of physically and emotionally. I have to be honest, as a council, I think Neath Patava Council are very good at recognising that. I think they're responsive, you're responsive, and there are lots of things on offer to support staff well-being. I would say from our perspective, you know, led by the director from the beginning across the whole of the directorate, you know, it's an open door policy. We are very hands-on, we're very visible, and that permeates right the way through the service. So all of the officers know that, all of the managers know that, all of the workers know that. Sometimes it's counterproductive, because we are always available all of the time. So I think that hits everybody from time to time. But I will hand over, that's my perspective as a head of service, we'll hand over now to Carly and to Nune, because it's important that you hear from them.
Thank you, Kerry.
Yeah, I mean, I guess I can only just echo what Kerry said in terms of the pressures in the front door. Everyone does do their best, and I think social workers tend to kind of almost go above and beyond a lot, don't they, in terms of what because they hold that responsibility and that accountability for the families that they're there to support. We are very visible. We are very visible to our teams, as Kerry says, and operationally we're on the ground, we're there, we visit the teams, we participate in kind of team meetings and things as senior managers as well, so that the teams know that they've got access to that support. And there is a lot available through this council, because this is, although we're under a lot of pressure, and there we have had some recruitment difficulties, we are doing really, really well as a general kind of directorate when you compare us to some of our neighbouring local authorities, certainly, but just generally what the kind of market looks like at the moment. So the general feedback that we do get from staff is quite positive, and we do try to be as available and visible to them to be able to recognise the pressures that they're under and try to support them as much as that we possibly can. Carly, I don't know whether you want to come in and kind of talk to what that looks like on the ground as well.
Sorry, yeah. And something I just wanted to add to what Kerry said as well is for some people, the pandemic kind of, for want of a better phrase, broke them then and said, I can't do this anymore. But for some, it made them, and they really flourished. And a few staff that we've lost in the team, just as I arrived or just before I arrived, it was for promotion purposes, so kind of a step up. So that's a positive change that obviously we wouldn't discourage. But in terms of the team, there's been significant changes since I've come on board, and some quite rocky moments, but we've got through with it, with the plan that we've got in place, we've got through it. Particularly, I'm really fond, as we all are in MPT, of a big focus on staff wellbeing. And I think when the team are undergoing significant changes, losing key members and losing long-standing team members and bringing new staff on, I think wellbeing is the main focus. We do it really well in MPT between compressed hours, which nowhere else really does, and our flexible working scheme. We are really flexible in our team with the nature of our work. You know, we're a duty team essentially. There's more flexibility in it than you would believe really than first looking in. So that's how we kind of keep us, focus on keeping our staff's well-being kind of at the biggest priority. In terms of the supervision that we do with staff, it's every 4 weeks. And well-being is the primary focus of that. We talk about the staff well-being, that go through the format of supervision, and anything else they want to add to it or anything that's critical to add. We do talk about cases as well, but primarily well-being that we do heavily focus on. Again, like Kerry said, open door policy. People know they can come to me in or out of hours, and sometimes, yeah, of course, you think, as Kerry says, we have got kind of an open door policy, and we invite it in all hours. But I wouldn't have it any other way really to make to allow staff to feel supported. It just wouldn't feel right. I've been in teams previously where you feel like you can't do that, and you just start to feel like you're on your own. And in this work, you can't feel like you're on your own essentially. And of course, there's peaks and troughs. Of course, there's going to be times where someone is working, over their hours on on one day or maybe a week, and they may look back and they think, oh gosh, I put in a lot of hours this week. But again, it's peaks and troughs. And again, flexi, I'm a real big fan of flexi, and I really focus onto staff and say, you need to be prioritizing leave, and you need to be prioritizing flexi. Of course, I don't always practice what I preach, but we all don't, do we? So that's my primary focus. Yeah,
I think that is what actually I'm asking. How do you know that the system is actually working and people aren't stretching themselves so much? I don't expect an answer right now, as long as you are aware. And I'm glad to hear the 4 weekly supervisions. That sounds great, because that's a very good frequency to speak with staff. I just know that previously we did head into trouble because of lack of supervision and everything, and I didn't want it to go that way again. So I'm happy with the responses, and I'm reassured that you have it in your forefront, that staff's well-being, because we can't operate without staff. So thank you, Chair. Thanks.
Yeah, and sorry, just to add to that as well, it's about knowing your staff. So for me, one of the things I speak to staff about is, how do I know if you're not coping? What will
Exactly.
I see if you're not coping? How will and thankfully I've got to the position, in previous teams I'd been there years and years. This is a fairly new team in comparison. Some people I've known longer, and then you can identify the trends, so to say, but then also the other people in my deputy managers, I can rely on them to come to me and go, oh, do you know what, I think so and so is maybe struggling a little bit today, so we'll call them in for a chat. Teams is now working in the way we do is a blessing and a curse. You're ever so accessible, but also is perfect for those days where you've got a staff member who's struggling or something like that. We're extremely flexible. We've got one worker off at the moment. She's just had a car crash, and
can I just bring it now? We're going into more of a chat sort of thing. If I can just bring it back now.
Thank you.
Because I am conscious of time.
Yeah, okay.
And this is the last question or statement on this item, which I'll go to Sian Harris. Thanks.
Hi, I just wanted to commend our staff for the level of professionalism that they are doing at the moment in this period of high pressure. Excuse me, and I think it's good evidence that we're not actually losing all of our staff out of MPT. That actually some of them are moving across to adult services. So I think it just proves that MPT are looking after the staff. It's just that children's services is a very high pressure role. So thank you, guys.
Thank you, Sian. Agenda item 11, Children and Young People, Adult Services and Houses, Community Safety, second quarter. Again, this report is for monitoring, and we will go straight into questions on this item, which I've got Councillor Whitelock, please.
Yeah, thank you, Chair. Just to say, I think the question I was going to ask was on staffing levels, sickness and recruitment, which I think was just answered adequately in the last one. So I think we can move on.
Yeah, thank you.
Thank you.
Councillor Helen Kerry Clark, please.
Yeah, I wanted to ask about the homelessness prevention on page 199, I think it was. I've been working with quite a few people who are at risk of immediate homelessness. You know, they've been served orders or what have you. And they've been, I appreciate there are no properties. I know that. But, you know, these people have been told, oh, well, wait until they take you to court, which isn't ideal, really, because it just heightens their anxiety and their worry, because then they think, you know, they're going to be more at risk of being put out earlier. So I just wanted your views on that. And also, why do we not have a central list for housing? Why have people got to apply for like 6 or 7 or 8 housing associations? Why can't they just be down on one list and then it's shared among them all?
Thank you for the question. I'll answer the last question first, and then I'll answer your first question, and I think Emma will probably come in to give a bit more information on that. So yeah, we do not have a common housing register or a common allocation policy across all the RSLs that operate in Neath Port Talbot, and that is something that was established and set up when we transferred our stock over to an RSL. We recognise as well that it is very difficult for people to be applying for 5, 6 different RSLs, 5, 6 different application processes, and you know, and then all the bidding as well that goes with that. It doesn't lend itself to a very good consumer focused way of doing things, or you know, it's not very person centered. So they were decisions that were took years ago when we transferred our stock, that was the way it was going to be done. But we are actually having conversations with our RSLs to establish a common process, so that there is one kind of application process, but it will require the RSLs to agree to that. So work is going on with the RSLs to see if we can move towards that. There is also a white paper by Welsh Government out at the moment that within that white paper suggests that everyone needs to move to something called a common housing register, which again is exactly what you say. So we are working very closely with the RSLs to see if we can improve those matters. And then with the second question, Emma, I think you'd be best placed to respond to that operationally. Thank you.
Yeah, that's fine. Thank you. Yeah, in terms of somebody that presents to us who's had a notice to quit, to leave a property, the advice that they get from the officers is basically there's 3 stages to an eviction process. So that would be explained to the applicant. So the choice then remains with the applicant at what point they want to come into temporary accommodation. So somebody may say at stage 1, when their notice expires, they are eligible at that point. Other families would prefer to sit it out until the actual warrant of eviction, when they absolutely have to leave, and that then obviously delays the time that they need to go into temporary accommodation. So we don't make those decisions on behalf of the households. You know, I just want to make that clear. I think that's important to note. They will have the advice, and then the decision at which point they come in is with that individual family or applicant.
Back, Ellen.
Yeah, oh, thanks for that. I'm glad you're in discussions about having a central list. One thing I've been thinking about is why we do we have specialised support for people who are, say, disabled or long-term sick and are being made homeless, because they're even worse placed to deal with all the different processes and often have specific needs that they may find difficult to get over.
Yeah, we've got a number of services that we can put in place to support those that are at risk of experiencing homelessness. The Housing Options team, They provide advice and assistance, and we also have a number of providers as well. I suppose disability is quite a wide-ranging subject. So we do have some specialist services that will support people with mental health, for example. But we also have, whilst we don't necessarily maybe have a service that would support people with physical disabilities, for example, the support services are person-centred, so they will look at what support that individual person needs, if that makes sense.
Yeah, thanks, Ashley. I can't see any other questions. Just bear with me. Oh, Councillor Freegard.
Yeah, sorry, Chair, I'm going to have to flick back and forth to my papers because the PC's not packed in completely. I was just going to ask on page 184 about the LAC reviews. When will we have the detailed report, please?
I'm happy to come in on that, Chair. It's drafted. I've just reached out to the teams just to understand some of the systems issues that impact on some of the findings. So once I've bottomed that out, I'll get it over to you, Councillor Freegard, and the other members.
Oh, that's great. And on page 219, with the long-term sickness, given that we've got the vacancies there, number 11 vacancies, is the long-term sickness covered by other staff who have been upgraded or acting up?
If I come in there, and I know we've got HR on the call as well. In terms of we have to cover our statutory responsibilities. So if there are, depending on where those workers sit, if they're qualified social workers, the work has to be done. I will give permission to backfill, to bring in people. As you can see, I've done that in the front door where we've got agency staff covering at some cost to the council. They're averaging £90,000 now an agency post.
They are identified as a group, a cohort of their own. You have identified that on the table on their own. So we've got the agency staff, but we've got the sickness staff. What I'm trying to find out is, are those, say, 6 places covered by staff, or are we shelving out their workload to other social workers?
So the work is covered. In the main, the work is covered within the team. So if there are vacancies within a particular team, it's the team that would pull together to cover that work. It would only be, and it tends only to be the front door, to be honest, where we would have to negotiate with other team managers for work to go further across the service. But the work is generally covered within the team if there is sickness. And then I would take a view on a weekly basis with the officers about how that's best managed to make sure that we're meeting our statutory responsibilities.
So Kerry, you know, the extra workload, is that causing delays, a knock-on effect with delays elsewhere?
No, I would say not. I mean, our performance, we've set the bar very high. So our performance is very high. It's within the top 3 in Wales in terms of our timeframes for meeting statutory timeframes. It's very high. But that's not to say that we don't strive to do better. So no, there isn't anything that's due to staffing is people are working harder, they're doing more, but it's certainly not impacting on the performance of the service.
Yeah, we don't really want them to work harder. We want them to work smarter, but I just didn't want to have overloaded casework really for the employees. Yeah,
so the nature of the work for us, it's the nature of the work is difficult, you know, because because, you know, we're dealing with families and children's lives, and we're often in very harrowing situations. So for us, it's more about the nature of the work. The caseloads, again, one of the lowest caseloads, and we did an exercise week before last with the other heads of service, and ours, I think, I won't say it's the lowest, but it's certainly within the bottom 3 of being the lowest caseloads in the country for children's services.
Yeah, the point I'm making as well is, if you were saying that we're coping without those 6 people who are on long-term sick, then why would we employ more people?
Well, it goes back to a work-life balance. So, you know, if there's going to be equality, if there's a standard to the work that we do. So when you look at just raw data, and we're counting, if you like, we're counting, you know, to make sure that we are visiting children where there's a written child protection plan within our statutory sort of arrangements, or we're visiting children where they're in foster care, and we're doing that within a statutory time frame. That's just counting the visits to make sure they're done on time. The quality of those visits, you know, is what counts, and so that takes time. So, you know, without having the staffing levels that I've currently got, we would be tipping workers over into going way beyond, you know, what they're employed to do. So workers are flexible. They know they don't keep to a 37-hour week. They work over anyway, and they're flexible within that. But if, you know, I wouldn't be comfortable about workers routinely working the hours that would need to be worked if we didn't have those the staffing levels that we've currently got.
Right, I am a bit concerned about
Okay,
that.
I'm just going to stop that a minute now.
Okay.
Can you just take whatever else outside of the meeting? Yeah. Can we know that obviously report is for monitoring. With that, I've gone back now, haven't I? Yeah, bear now. Yeah. So back to the scrutiny agenda now. Yeah. Just bear with me. Yeah, agenda item 6, committee action log. There is nothing for noting. Agenda item 7, this item is for noting unless members have anything specific to raise. For the forward work programme, anyone got anything to raise there? No. Agenda item 8, I have no urgent items. Agenda item 9, we will now need to consider the private items included on the Cabinet Board agenda. As you can see on the agenda, the private paragraph is there for everyone to read. Can I please have a proposer and a seconder to move into private? Can I please ask that any public or press in attendance now exit the meeting, and can the recording be stopped? I will propose.
I'll second.